The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
You know, on these gorgeous summer days, it can be fun to get outside and try something new, like rock climbing or kayaking. But before jumping in, you need to know how to stay safe and prevent injuries. Here with some expert advice, we welcome from Providence Sports Medicine, Dr. Peter DeJong. Good to have you with us, Doc.
Good to be here. Thanks for having me.
You bet. So let's talk about this. What are the most common injuries that you see when it comes to summer activities?
That's a good question. We see a lot of overuse injuries. We see a lot of tendonitis in the shoulder, the knee from people picking up new activities or trying new things, like you mentioned, hiking, biking, kayaking, all that kind of thing. And then you can always get hurt with falling, and you can, twist your ankle, twist your knee, sometimes break bones.
Oh, you said that so calmly. That's not fun. Having broken one, I get it. So when it comes to those kind of overuse injuries, is it people who basically are weekend warriors? They're sedentary during the week, and then on the weekend, they're like going at it for sure, you know?
Yeah, it definitely can be. Anybody who's taking on a new activity or a new level of their current activity is at risk for that sort of thing. But yeah, it can be.
And what do you say about what are the most risky and dangerous things for people to do? Like what common mistakes lead to those injuries?
I think lack of preparation is probably the biggest mistake that can lead to injuries, whether it's lack of knowledge about what the activity is going to entail in terms of exertion or weather or time, or just terrain. That can all play a part in situations where you may be outside your comfort zone, which is usually what predisposes people to a variety of kinds of injuries.
Yeah, I was going to say like biking on a rocky trail, that kind of thing. Mm-hmm. Okay, how much does heat, because we've got a hot week here, how much does heat and hydration play in all of this?
It plays a huge role. I think some of the more serious situations people can end up in over the summer are related to heat and hydration, because it can be, a combination of heat, humidity, and sun can put you in a position where you can get pretty dehydrated pretty quickly if you're not prepared.
When do you know that you should go to the doctor, go to the hospital? When do you think that's okay, this is it, I gotta go now?
Yeah, that's a really good question. That's kind of the age-old question, because people will come at a variety of times over the course of, our clinic day. People will say, oh, this happened yesterday, or oh, this happened 3 years ago. And I think a general rule of thumb is if it's something new, if it's from a summer activity, from an injury, and it hasn't gone away with kind of normal management techniques over like 2 or 3 weeks, it's a reasonable amount of time to come in, unless there's a bigger injury where you fall and maybe a joint is swollen, or you see a big bruise, or you feel a pop or something like that. Those usually indicate a bigger injury that probably needs to be seen sooner than later.
Are you seeing more pickleball injuries?
Over the course of the last few years, I've seen quite a few pickleball injuries, definitely.
And is that just not the stretching and not hydrating, that kind of stuff?
That's a good question. It's a lot to do with the movements that are specific to pickleball, and lack of stretching, lack of warm up, lack of just like proactive strengthening of certain things, and kind of having a overall routine of fitness rather than just going out and playing pickleball.
Right. When it comes to summertime and high school athletes who are training during the summertime, what tips would you give them?
I think the biggest things for training on your own for a college or high school athlete is going to be, again, preparation. It's going to be knowing your hydration strategy, being hydrated beforehand, making sure you've fueled enough beforehand, and then, avoiding training outside at the hottest part of the day is a good idea. So morning or evening all evenings can be pretty warm too.
Yeah, makes a lot of sense. We want to tell everyone, if you would like to find out more about Providence Sports Medicine, we'll put the information for you as you see on your screen, 50329-SPORT, or you just go to k2.com/Family Matters. Thank you so much, Doc. Great to see you.
No problem. Thanks for having me.
You bet. All right, we'll be right back with more AM Northwest. Don't go away.